Now, how this hypothyroidism is treated or how this thyroxine is given. That's very simple. Anyone who is diagnosed with newly diagnosed hypothyroidism, where TSH is usually high, most of the time it is the normal level of TSH is between zero point 0.3 to 5 milli international unit per liter. So, if it is in between 5 to 8, and if the anti-TPO antibodies are negative, or if the patient does not have any symptom, we can simply monitor. We can ask the patient to do have healthy lifestyle. We can ask the patient to do physical activities, yogas, and we can ask them to repeat the thyroid function test after 1.5 months. If it reduces to less than 5, the patient does not need treatment. But if it persistently remains in between 5 to 8, then definitely we treat. If TSH is above 8, we definitely treat and we start the treatment with thyroxine medicine. So thyroxine is in short actually the thyroid hormone. That is what we actually give to the patient. Now, what is the initial dose of the thyroxine that we start? It's very simple to calculate. We simply see the weight of the patient and we can start the thyroxine dose from weight into 1 to 1.5. So if someone has weight of 70 kg, then we can start around 75 microgram, because the dosage are all in the multiple of 12.5 microgram. So you get 75, you get 88, you get 100, you get 112.5, you get 125, so on. So if someone has weight of 70, then we can start them on 75 or 88 or 100. So I usually start them mostly on 100 microgram if the patient's weight is around 70. So we can start from weight to weight into 1.5 we can start. If someone has weight of 60, then we can definitely start with 75, we can start with 88, or we can start with up to 100 microgram also. So it is the weight into approximately around the weight, or weight into 1.5. We can start with the initial dose, and we ask the patient to repeat the thyroid profile test after 1.5 month, means around 6 weeks, because the TSH has half-life of around 7 days. So after 6 weeks, we repeat the thyroid profile test, and this thyroid profile test has to be done in fasting state only, because food can increase the levels of T4. It can modify the TSH levels. The thing is, if after 1.5 month, if the thyroid function test is repeated, and if it turns out to be normal, if the TSH become normal, we should not reduce the dose, but in fact, we should continue the same dose that we are giving to the patient. It simply means, suppose if someone is taking 100 microgram of thyroxine, Thyroob, or whatever the brand he's taking. After doing the thyroid function test after 1.5 months, if the TSH becomes normal, T3, T4 come normal, it means ki the patient's body needs 100 microgram of thyroxine hormone per day, and it is perfectly suiting to his body. So we should simply continue the same dosage, and we should advise the patient to do the thyroid profile test every 3 to 6 months if the thyroid profile test remains normal always. Suppose after starting this thyroxine medicine, if someone has weight of 60, and we start suppose 100 microgram of thyroxine medicine to that patient, and if that T4 comes high, and if the TSH reduces to less than zero point 0.3, it means that whatever dosage we are giving, it is becoming slightly high, because the TSH should come normal and T4 should also come normal with our treatment. If after starting this dosage, if this T4 becomes high and TSH reduces to less than zero point 0.3, then we should reduce the dose of the thyroxine by two-thirds. So in that case scenario, we can make this 100 to either 75 or 88. So I would prefer to reduce the dosage of thyroxine medicine by around 25% to 33%. So I will reduce the dose from 100 to 75, and I'll advise the patient to continue 75 for around 1.5 month. And after a month, we can again reduce, we can again do the test. If that time the thyroid profile test comes normal, then I'll continue the same 75 microgram dosage. If suppose by any chance, if still the T4 comes high and TSH still remains less, then I'll again reduce the dosage of thyroxine from 75 to 50. Uh, but in case suppose if you have started a patient on 100 micrograms and after 1.5 month, if the TSH still remains high, if suppose the earlier TSH was around 35 and after repeating after 6 weeks, if it comes suppose around 15, it means that the thyroid deficiency has definitely improved, but it has not completely normalized. In that scenario, I would increase the thyroid medicine or thyroxine hormone by 25 to 50 microgram. So if the patient is on 100 microgram of thyroxine, I'll make it 125 if even after 6 weeks the TSH levels come high only. So this was all about the dosage. We'll meet in next topic again. Thank you.